Dr. Meyer always tries to bring us a little hope on the road to recovery, or maybe just keeping us in good shape. So,
thanks, Dave.
Yeah, absolutely. So, let's talk about some things today. And one thing we're going to talk about, month of May is Mental Health Awareness Month.
Huge. It's huge. And when it comes to hope and healing, our body has a memory, and this circuitry in our brain, nerve tissue, sometimes gets stuck. So whether it's a physical trauma or it's a mental trauma from something like a death in the family or a pandemic trauma the last 3 years, how many of us haven't been traumatized? That stuff can just stick there in the body, and a lot of times it finds places that are already injured, not performing well. That's what we saw even with COVID. So if you had somebody with difficulty breathing, lung problems, or memory problems before COVID, that spike protein come along and hit that area that was already weak and make it worse. It would traumatize that area. So it's the same thing with mental health trauma, and so that can hit that area, and whether or not that's lungs or it's brain tissue that might be suffering ahead of time, and it can just hit it and make it stay there. And so that's where you have to use a lot of the different, again, tools in the tool belt that I always talk about. You come in for an appointment to the clinic. We talk about the different things. Of course, traumatic brain injury is a type of trauma to the brain as well, seen in our troops. And hyperbaric therapy is one of those tools in the tool belt. So huge for concussion, traumatic brain injury. But, I don't want to overlook the emotional trauma. That is just as big in many cases as a physical trauma. And most of us, we go in and we get a medication like a Lexapro or Zoloft, and it's just there to kind of cover up the symptoms. But are we dealing with the trauma, the root cause? Are we dealing with moving that energy, that emotion out that is stuck in the body? And there's a lot of different ways to do it outside of the different tools in the clinic. A lot of times it's working with somebody that is an emotion energy worker, something like a counselor, that really focuses on how do we move that trauma on and get ourselves walnut up, get ourselves into a place where we're not stuck in that cycle of trauma.
And one thing that statistics are showing, that since the onset of COVID, mental health issues, especially in young people, those numbers have gone up significantly. Not 100% sure why. Might have to do with the limited amount of actual eyeball-to-eyeball contact people were having. But the fact of the matter is those numbers have gone up. So there's people that are hurting and need help.
Oh, absolutely. I mean, what we did with this pandemic, you look back to the 1918 influenza, the Spanish flu. They tried some of the same things, with wearing face masks back then and the distancing, and really from a public health perspective doesn't make a whole lot of sense, and doesn't prevent the movement of these viruses or contagions. But what it does do is it creates a traumatic experience. If you're putting social distance between people, like to be around each other, we get energy and love and support from being around each other, and if we're covering up our face, that emotion, communication is blocked. And I think of the folks in the nursing homes over the years of the pandemic as well, that were socially isolated. These things are traumatic experiences that get stuck in the body again, and we need to work through those as we exit this pandemic period.
Yeah. So mental health, again, you brought up Lexapro, Zoloft, something like that. And these drugs, boy, I'll tell you what, some of these drugs can be very difficult to come off of. You might think you're hoping for a miracle cure, and some of them, some folks may be, but some of these drugs, if they don't work, they have some pretty significant side effects.
Yeah, like any medication, downstream, there's a lot of things that can also be affected, and the longer you're on a medication. So, but yes, particularly some of the mental health medications can be a bear to come off of them, and they take a slow wean to do it. And a lot of times you want to use a multifaceted approach when you're coming off of some of these medications. You, of course, want to work with your medical provider to do that safely, but utilizing different tools, again, red light therapy that we have at the clinic, doing the PEMF pads, which is it's a technology out of Switzerland that's very helpful with inflammation and mood. We have something called brain tap, hyperbaric therapy, and then getting in with our counselors and our specialists in the mental health field that are also working, because there's a lot of other natural supplements and ways to, with some of these different modalities I talked about, to get you into a realm where you're not on the Band-Aid, the SSRI, the selective serotonin reuptake inhibitor type of thing. So if you want to go that direction, there are options to get yourself balanced and not on that pharmaceutical. I just had somebody come in yesterday for some memory. It was a memory consultation, but she was frustrated with the amount of time that she had in her regular doctor's visit. So she's going to be coming onto the integrative DPC membership model, where we at Okoboji Wellness Clinic are helping manage your day-to-day healthcare needs. So that may be prescription refills, some acute care, that whatever may pop up from day to day, and then a lot of preventive care, chronic disease care. Field questions about integrative DPC, integrative direct provider care. Again, it's a monthly membership model where you come in, unlimited appointments with providers, myself included, where you have an extended appointment time. So with her yesterday, I had about 60 minutes to really go into some deep waters, and that was refreshing. There was no push to move her out the door. As well, a nice little thing I'm going to be doing is welcome DPC visits, where you get a half-hour visit with me. You can call the clinic to make an appointment for that, just to talk about what it would mean to do this membership model and do the integrative DPC, where I'm kind of in my old vein. What I used to do was family practice care. That's what I'm doing now, again, through this model. It's a membership model, a monthly membership model, like think of it like a gym membership. So,
right.
Yep.
So, and that's one thing, when we talk to you, we want to make sure that we always mention the fact that if somebody comes in that has some type of severe infection and needs an antibiotic or something like that, you're going to do that. If right?
Correct.
I mean, it's the whole toolbox.
It's the whole toolbox. I'm doing the old and the new. Mm-hmm. I like to do the old better, and mm-hmm. So what I have learned in the past, I'm always evaluating what I've been taught in my medical career and trying to adapt and change and say, all right, can I do things better? And statins are a big buzzword for many people, cholesterol medicine, and I used to recommend them a lot for if you had high cholesterol, you had some heart and stroke stuff. What I've come to learn is there's more of a narrow window when I would recommend statin therapy. Mm-hmm. So those are the kind of things that but yes, Dave, I'm doing if somebody is wanting to stay on a statin and they're wanting to stay on their traditional treatments, this is what it's about. It's a doctor-patient relationship. It's a conversation, mm-hmm. and I give you the different options. So mm-hmm. if you're like, no, I really want to stay on that, then we have that discussion and we send in refills. So,
yeah, and the one thing that we talk about often, and we're already out of time, but we want to move people from not just surviving, but actually living. A lot of people out there right now are just hanging on. They're just surviving, getting through the day. We want them to embrace life and live.
Correct. We want you to know that you can thrive, and it's not just the inevitable aging, that are the aches and pains. There are a lot of things to do. Deprescribing medication, getting rid of things that might be cross-reactivity with different medications. But let's work on not just surrender to to the inevitable aging. There's a lot we can do to live better and live more well. So 3305 Berquist Avenue, just north of Fix Ace Hardware in Spirit Lake. You can call us too if you have questions, 712-339-6024.
And you can go to OkobojiWellnessClinic.com. We'll maybe talk more about mental health and how things can lead to a mental health issue. For example, we know somebody that had probably significant concussion issues, and if those weren't taken care of and fixed, you could see how that could lead to something depressive or mental
symptoms.
Yeah.
That's the traumatic brain injury with the troops, that they had that concussion, that roadside blast, and then they end up with irritability, dementia potentially down the line, and really bad depression. So it's you got to catch it early.
Yeah. Very good. Doctor, thank you so much. Dr. Bradley Meyer with us today talking about the Okoboji Wellness Clinic. Again, find them at OkobojiWellnessClinic.com.